Hey everybody, welcome to Yoga Janda. I just got a little bit of information for you regarding delayed cord clamping. ACOG, American College of Obstetricians and Gynecologists, suggests that delayed cord clamping will be about 30 to 60 seconds after birth. But we do know that delayed cord clamping helps babies transition to life outside the womb better. They have higher red blood cell counts, so higher hemoglobin. It also helps with iron stores for the first few months of life. So sometimes breastfed babies can be anemic, and so if you do delayed cord clamping, this can help with their iron stores so they don't become anemic. So it can have a very tiny increase in jaundice, but doctors will look for that. Jaundice usually peaks at about day 4-ish. And so usually you'll see your pediatrician about that time, and they will look for increased jaundice. So breastfeed, or just feed your baby and just flush the bilirubin out of their body. So here's what I wanted to show you was delayed cord clamping, according to ACOG, which is what you'll probably get in the hospital, is about 30 to 60 seconds after birth. Now, if your baby's perfectly healthy, there really aren't any issues, and there's probably no reason for the cord to be clamped and cut at 60 seconds, say. And I've been teaching for 25 years, and basically the concept of leave it alone usually works out pretty great for most babies. So the cord is still pulsing, so there's blood still coming from the placenta into the baby. And we want to help that baby get all that blood, and it's about this much. This is not real blood. This is just vegetable dye and water. I promise it's not real blood. But if you clamp the cord before it stops pulsing, your baby's going to miss out on about this much blood, maybe a little bit less. I may have overfilled this a little tiny bit, but about this much blood. So your baby's not going to get that blood that was in the placenta. So the placenta, the baby only gets about this much blood. So if you want true delayed cord clamping, you want to wait until that cord stops pulsing, rather than allowing it to happen at 30 to 60 seconds, according to ACOG. The whole concept of why they used to clamp and cut the cord immediately was, back until up until the 1950s, women were put unconscious with what was called twilight sleep. And when they had twilight sleep, they weren't able to push their babies out. Not only were they asleep, but the babies were kind of limp and pretty out of it, just like the mother was. And so they needed to get that baby away from mom, stimulate that baby, make sure the baby was okay. But in this case, even if you have an epidural, or if you have a natural birth, an unmedicated birth, a C-section, that might be a whole different story. But if you have a vaginal birth, consider delayed cord clamping until the cord stops pulsing. That's your little lesson for the day. So thanks for joining me.